Welcome everyone to the third installment in our webinar series on the European Health Union, and thank you for joining us. My name is Dimitra Pantelli and I work with the European Observatory on Health Systems and Policies. Together with the European Health Forum Gastein, we are organizing this webinar series under the European Health Union initiative. So the initiative aims at advancing the European Health Union beyond crisis preparedness and adding value for societies and for citizens. Earlier this year, we looked at the issues of joint purchasing in our first webinar in the series and the collaboration on equipping the workforce with the digital skills for the health systems of the future in the second webinar. Today, we are focusing on the European reference networks. European reference networks were introduced by the 2018 Patients' Rights Directive on cross-border care to optimize care for patients with complex or rare diseases and conditions that require highly specialized treatment. By facilitating discussion among providers in different European countries and bundling, of course, knowledge and resources. They are virtual networks, to review a patient diagnosis, ERN coordinators convene virtual meetings, advisory panels from specialists across different countries and disciplines using dedicated IT tools. The first ERNs were launched in 2017, and we have, in the meantime, over 20 ERNs working in a range of areas. We also have first evaluations of the ERNs, where we see successes, but also challenges. It's very clear under the European Health Union concept and the European Health Union initiatives that ERNs, this opportunity to bring together providers from different settings, the highly specialized experts on the individual patient, is really a very, very useful tool. So what we aim to do with today's webinar is to hear about the experience of the first years of operation and the evaluation, and think about how we can build on that experience to make the role of the ERNs even stronger towards a stronger European Health Union. We will hear, most recently, we have the evaluation of the cross-border healthcare directive that was published just a couple of weeks ago by the European Commission. So we will hear about that, and we will talk with colleagues from different perspectives exactly about how to bring the ERNs forward. Before turning to our panel and starting the discussion, a couple of housekeeping rules from our side. As always, we want to hear from you. Some of you already sent us questions and comments in advance, so we're very grateful for that. But you still have the opportunity to interact with us now. So there is a chat box, so please use it for questions and comments. And my colleague Erica Richardson, as always, is there to keep an eye on what you write and feedback to the panel during the discussion. Thank you, Erica. And at some point during the webinar, after we've heard from our panelists, their first insights will come to your inputs and feedback and discuss further. So without further ado, I would like to present our very, very distinguished panel today. We have Martin Dorazil, who is Deputy Head of Unit for European Reference Networks in Digital Health at the European Commission, at the Director General for Health. We have Magda Klebus, who is the Executive Director for Science, Policy and Regulatory Affairs at FPA. We have Jan Lecam, Chief Executive Officer at Eurordis. Ruben Diaz, who is the Secretary General of the European Children's Hospital Organization and in a number of ERNs as well. Birute Tumiena, Head of the Division of Clinical Genetics and Genomics at the University Hospital in Vilnius. And we will hear from all of them, from their different perspective and complementary perspective about how we can work in this area. First, we go to Martin for his presentation, reflecting to us the first years of experience with the ERNs. Martin, I remind you, we have about 10 minutes, and I will be strict because we have so many interesting perspectives to hear today. So if you see me appear at some point, it means you should wrap up. But we're really looking forward to your input. So I pass the floor on to you directly. Please tell us what the evaluation of the cross-border directive found on ERNs. Thank you.
Thank you very much, Dimi, and good afternoon, everybody. Thank you for giving me the opportunity today to present a little bit the results of the evaluation of the cross-border healthcare directive, and in particular focus on the conclusions regarding the European reference networks. As you very well explained, Dimi, already, we are at the point, 5 years after the establishment of the European Reference Network. So it's a rather special moment, because the European Reference Networks are still in the development stage. They are still developing and evolving themselves. At the same time, 5 years is already a sufficient time to do a first evaluation and look at what is working well and where there is a scope for improvement. And this is what exactly we have done through the evaluation. So I will ask for a next slide, and I will start very briefly with a general introduction. I mean, what the European reference networks are, what is their objective, what is their aim. So this is this picture is taken from the Commission's website, and it shows a virtual map with all the existing ERN members that are connected to the system. Since 2017, the system grew quite significantly. So as of today, or as of 1st of January, actually this year, after the most recent enlargement of the ERNs, we have almost 1,500 members of the ERNs being part of the system. And I'm glad to say that we now cover all the EU member states plus Norway. Next slide, please. Currently, we have 24 European reference networks in place in the area of rare or low prevalence complex diseases. Each of the 24 networks is covering different rare condition or rare disease. So here is the list of the existing 24 networks. Next slide, please. And to explain a little bit, and Dimi, I mean, you already mentioned it yourself. What are actually the ERNs? What are they doing? What benefits can they bring to the European patients and to the healthcare providers and health systems in general? So the underlying idea behind the ERNs is that, especially in the area of rare diseases, it is very important to bring together and pool the knowledge and expertise that is very scarce and scattered across the EU. So the ERNs are bringing together the most qualified and skilled experts in the field. They bring them together through the virtual remote consultations and clinical discussions through a telemedicine IT tool on individual patient cases. So they are directly involved in helping to provide the right diagnosis and the right treatment to the patients with the rare conditions. But that's certainly not the only area of activities of the ERNs. The ERNs are also very active in generating knowledge on rare diseases. So, for example, in producing clinical guidelines and other clinical decision-making tools. They are also involved in various research projects and research collaboration in the area of rare diseases. And they also contribute to education and professional training, for example, through developing training programs and e-learning programs and other activities. Next slide, please. So now I'm moving a little bit to the exercise of the evaluation of the cross-border healthcare directive. The directive was adopted in 2011. It covers different areas of cross-border health activities. So an important important part of the directive is looking at the issues of cross-border healthcare, access to cross-border healthcare, and reimbursement of healthcare that is provided in another member state. But there is also an important part of the directive that is looking at the issues related to the cooperation between the member states in the area of health and care. For example, in the area of health, e-health, in the area of cross-border regional cooperation. Initially, also the area of health technology assessment was covered by the provisions of the directive. And an important provision of the directive concerns the European reference networks. It's the Article 12 of the directive, which provides the legal basis on which the ERNs are actually established. So 10 years after the adoption of the directive, the Commission decided to carry out an evaluation of the policy and of the legal framework that is in place, following the principles of the better regulation that are being generally applied by the Commission. This evaluation of the cross-border healthcare directive was analyzing and looking at different aspects. So among other things, it was looking how the directive's objectives to facilitate access to safe and high-quality cross-border healthcare in another member state has been met. To what extent is the directive relevant for meeting patient needs in cross-border healthcare, and so on. One important element that the directive also looked at was how the treatment and diagnosis of patients with rare and complex diseases have benefited so far from the support of the ERNs, and that's the main focus of my intervention today. Next slide, please. So as part of this general evaluation question, some more nuanced or detailed evaluation questions have been developed. So some of them are on this slide. So the evaluation looked at how effective is the directive in supporting the diagnosis and treatment of patients with rare and complex diseases through the ERNs. How effective is the directive also in facilitating knowledge sharing, so going beyond the clinical collaboration and supporting knowledge sharing among the healthcare professionals. What has been the impact of the directive on the research in the area of rare and low prevalence complex diseases? Are the ERNs set out in the directive still relevant today for meeting the needs of patients with rare and complex diseases? And in what ways the ERNs established by the directive provide added value to patients in comparison to the national solutions alone? Next slide, please. So the evaluation of the cross-border healthcare directive started in January last year by publishing a roadmap, which is the usual procedure. And the Commission, with support of an external contractor, carried out an evaluation study, which applied a mixed methods approach to answer the study questions. And this mixed methods approach included an extensive review of relevant literature and documents, but also analysis of the website of the national contact points for cross-border healthcare. Very important point, we organized an open public consultation last year, over the summer last year, through which we received almost 200 responses from a wide range of stakeholders. And also we conducted a targeted stakeholder consultation activities, including interviews and questionnaires. And in total, through this targeted exercise, we engaged with 285 stakeholders at both EU and national level. This included very close contacts with the ERN community, including the coordinators of the existing European reference networks, also members of the ERN board of the member states, so the representatives of the national authorities dealing with ERNs at the national level, and with patient representatives. And on the basis of all this work, a final evaluation report was published a little bit more than 1 month ago, in the beginning of May this year. Next slide, please. So what were the main findings of the evaluation? In general terms, the directive concluded that the evaluation concluded that the directive had a substantial impact in the area of rare diseases, and that was a positive impact to support the diagnosis and treatment of rare patients, and also that the creation of the ERNs mobilized substantial commitment from health professionals and investment by healthcare providers in the area of rare diseases. It confirmed that the ERNs facilitate knowledge generation and sharing, that the ERNs involvement in research on rare diseases is critical to find solutions for patients encountering one of those conditions. And it also confirmed in terms of some specific figures that currently we have almost 1,500 ERN members being part of the system. And in addition to that, more than 200 affiliated partners from, for example, member states that are not able for the moment to have a center on their territory that would fulfill all the criteria to become a full-fledged ERN member. And currently, the system covers all the EU member states and Norway. The ERN members in total treated 1.7 million patients already. The patients participated in 732 clinical trials within the ERNs, and also patient representatives are very well integrated into the collaboration process through the ERNs. So these were the findings of the directive in terms of what is working well and where the ERNs are really bringing added value. Next slide, please. But of course, the evaluation also look at things that could be improved in the future, and identified some existing challenges or issues that should be further addressed. So again, with the caveat that we need to bear in mind that the ERNs are in place only for 5 years, and they are still, in this evolving stage. There are important issues to be addressed in the months and years to come, and these include issues related to complex and sometimes non-interoperable IT facilities that are available to the ERNs, for example, for their virtual consultation. One issue that was raised through the evaluation is the existing complexity of the ERN funding and need to streamline the existing system. There is an absence of a mechanism for reimbursement for cross-border virtual ERN expert panels, and that's also something we should be focusing more in the future. And the last point on this slide, but I think it's probably the most important one, is the insufficient integration of the ERNs in the national health systems, and the absence of clear patient pathways on how to access the expertise that is available at within the ERNs. Next slide, please. And I have just 2 last slides, so I will finish quickly. So based on these findings of the evaluation, what is the way forward? What would be the next steps? In general terms, the evaluation concludes that safeguarding the sustainable development of ERNs requires action by member states, supported by the Commission, to better integrate in the ERNs into the national healthcare systems. And also, solutions should be found to ensure the smooth functioning of ERN virtual consultation panels, so that more rare disease patients can receive the long-awaited answers about their diagnosis and treatment. In terms of practical operational next steps, the final evaluation report also includes an annex with some kind of a roadmap or action plan. And some of these steps that are proposed are listed on this and the next slide. So first, issue to improve the integration of ERNs into the national healthcare systems. To address this, for example, we will be launching later this year a joint action, and we would like to engage the member states in this joint action to work on the solutions to address this issue. Next slide, please. And that's the last slide. With regard to the improvement of the IT infrastructure, including the ERN virtual expert panels, we need to develop, and we are currently, in the process of developing a new version of the existing CPMS system, and we would like to make it available to the ERNs as soon as possible. With regard to the potential mechanisms for reimbursement of healthcare providers that are involved in the virtual expert panels, we are supporting, and we intend to further support the pilot schemes to explore various ways how this reimbursement could be arranged. And also, we should work towards simplification of the administrative burden related to the funding. So streamlining the funding, bringing all the different funding sources together, and make this system easier to manage for the ERNs. So I will conclude here, and we hope that with all these points addressed, we will provide even better possibility for the patients in Europe to use the benefits that the ERNs are offering to the most. Thank you very much.
Yes, thank you very much, Martin. This was both comprehensive and I think also very clear, particularly on the ways forward. We come to the ways forward a little bit later. I think what we want to do now is to ask our panelists to join us on screen, or rather our host to let our panelists join on screen, because we would like to hear how what Martin presented as the experience of the first 4-5 years of operation of the ERNs, actually, if that reflects your experience from your individual perspectives, and how that chimes with what you've seen. And I think we start with Jan from the patient perspective. Jan, you come from Eurordis. Let us know your thoughts. What has been your experience the first years of operation?
Thank you, Dimitra, and thank you, Martin, for that. We should always keep in mind that the title of the directive is Patients' Rights to Cross-Border Healthcare. And reading the European Commission report, really, we have the diamond of the ERNs, which clearly is a big progress in only 5 years, as Martin said, but which still needs to be polished and further. But all the rest is very disappointing. And I'd like to insist on that, because when you read the report, on page 16, it starts by saying that it's a success. But when you go from page 16 to 22, you see all the challenges in terms of access to healthcare across borders. And when you get to page 22, you see the disaster that it is for people with rare diseases. It is described in the report itself. So ERNs are a great progress, but what is absolutely not in place is the cross-border healthcare. Everything cannot be limited to the virtual consultation. People also need face-to-face meeting to cross borders. And for that today, they have a huge burden of prepayment. And we've seen from the figures that only 10% are using the current directive process because it's too complex. So they're using the social security regulations. And the reality today of the patients is that they are not informed about how it works. The report says they are informed, they are not informed. So I'd like to see the evidence that says that the patients are informed. What they're telling us is that they are not informed. The national contact points are not working. They are not connected to the national helplines, which when they exist, they are not connected to National Rare Disease Alliance. They are not or poorly connected to the centers of expertise of the ERNs. And the financial burden is high. We have stories of people who have to sell their house, to have advanced money, who have major difficulties to recover. So a key element for us will be that without changing the directive, but changing the implemented act, that the opinion of the ERNs become binding. They become, when a patient is pursuing a cross-border care, that what the doctor in the center of the cross-border care is, it becomes then binding to have access to a treatment or to a diagnostic to another country. That will really reinforce the system. And our vision is too much, just to finish on that, too much vision on the national aspect. The national aspect is important. We need to build the pathway. We're absolutely on that and pushing that. But also to keep in mind that the ERNs is also European system. It's cross-border. So we need to work in a matrix way in these two dimensions.
Thank you very much, Jan. I think it was quite useful to put the issue of the ERNs against the backdrop of the overall evaluation of the directive. When we come back to you in the second round on the ERNs specifically, the way that they have operated until now, maybe we weigh in on that a little bit. Birute, I come to you and ask you to give us your experience. You've been quite involved in the whole ERN process. So specifically on the ERNs, how do you see the evaluation findings?
Yeah, thank you very much. Being actually from a country like Lithuania, that is a small country and actually newcomer in the EU, so-called newcomer, I would like to give some thoughts about potential of ERNs to tackle inequities across member states in tackling rare diseases. In rare diseases, of course, we have champions and less experiences everywhere, and we may expect that those champions are from those older EU members and those less experienced from EU 13 countries. And indeed, the first wave of ERN call for true members actually was for those who attained to their highest standards. And the second was for affiliated partners, and it was a brilliant way to include less experienced centers into the ERNs and to establish really the link for every patient who is in need for ERNs across EU. So what are the results of this process? It has 2 waves of calls for true members and 1 of affiliated. 64% of affiliated partners come from EU 13 countries and 86% are from true members. Of course, we have some champions and less developed also across newcomers and the older member states, but it is really a brilliant way to tackle inequities, and I really believe that it will be. But this process depends not only on the wish of centers to enter ERNs, but also on authorities who designate affiliated partners. And therefore, we still have some whitish spots on the European map. We still have some countries with undeveloped links, even through affiliated partners, to ERNs. And that means that for these countries, ERNs may not only diminish inequities, but actually inadvertently, it may increase inequities. And national authorities have to take that into account.
Thank you, Mirjam. This is a really important point. When we come back to you, maybe also we will reflect on inequities of representation within countries, especially for certain areas. We come back to that topic. Ruben, we come to you. You also have a number of ERNs. You're linked to, you're connected with them. What has been your experience, in particularly in the area of child healthcare?
Well, thank you, Dimitra, for the opportunity. I do represent, a number of children's hospitals across Europe. There are reference hospitals, and I think let me, in this first round, bring to your attention the benefits of the concept of the ERNs that have had in the hospitals we participate, that I represent. In average, our hospitals have 17 ERNs within their system, so they've heavily invested in this process, and I think that has helped really galvanize some areas of the healthcare community, especially the pediatric community, since, as you know, 80% of rare disease patients are diagnosed in the pediatric age. Has actually helped us galvanize and understand and focus on on the rare disease patients. To be honest with you, I don't think any hospital right now even has the census of how many rare disease patients they're treating. So this is a great motivator for the children's hospitals to start, or hospitals in general, to start paying attention to these patients and focus a little bit their attention to their needs. So I think this is one benefit that this initiative has really provided for hospitals. It is also true that, as it has been mentioned before, that primarily the effort has been to at least try to provide these consultations, telematic consultations. And I think the expectation initially to sort of foster the cross-border care when it was necessary has been difficult to implement. And I think this is a discussion that we certainly can have a little bit more. And the other benefit, I think, and I want to sort of provide a positive bend on it, is that I've been very pleasantly surprised as to how hospitals have also opened to patient participation in some of the decision making around how to structure care for rare disease. This has been, in my opinion, one of the positive effects of this process. And I know that patient involvement has been at all levels here, at the commission level, at the ERN level, but I think hospitals are also becoming more aware of the need to have patients participate in this process. So this round, let me end here to give everybody a chance, but I think then we can discuss some of the issues associated with hospital management of this care.
Absolutely. We come, as you say, Ruben, we come to the tangible, what have we learned from that in a second. Mata, I come to you from the industry perspective, from the pharmaceutical industry perspective. It's a very important area for you, rare diseases. What has the experience been on your side?
Yes, indeed. Thank you so much for having me today. And I'd like to really start from where Jan started, that the cross-border directive, it's about delivering healthcare to the patients in the first place. We should remember, though, that research today is so intertwined with healthcare, especially in the rare disease space, where this is the best chance for patients to receive a treatment or an access to new technologies, to new solutions, that we also need to look at ERNs from that point of view of intertwining healthcare and research and helping developing new medicines for the patients in the future. And from that point of view, ERNs had been a fantastic success. Their setup is such a great opportunity for both healthcare and the research community. So let me make just 3 points related to public-private collaboration, because I think that public and private research should have the same access to ERNs and ability or possibility to collaborate with them. So first is, well, it works. Where the engagement can be there, it really works well, and it is a real win-win for all parties. ERNs have knowledge, they have a fantastic body of knowledge, they have fantastic ability to connect the dots and to work with patients, with clinicians, with everyone. So that's a fantastic achievement. Now, again, on what worked absolutely fine from the point of view of interactions between the public and private sectors is consolidation of standards, it's looking at the standards of care, it's doing all of that really helps progressing research. And one of the companies working with ERN said, actually, the body of knowledge that is there and the expertise is invaluable for medicines development. It is comparable with the advisory boards that companies have. So the knowledge is absolutely invaluable for research as well. Now, there were elements where it didn't work. So I asked what didn't work, why engaging collaboration was difficult. And there were 3 examples where one, it's the statement about collaboration states that there is a willingness to collaborate, but it's written in a way that may be perceived sometimes as being restrictive and not really encouraging, but really warning against collaboration or raising a lot of red flags. Second is that there are teething problems. People don't always know where to go, whom to find, who is the contact person, how to get there, and that's the other point. We should remember that ERNs are not homogeneous; they are all different for a good reason, and there is not a single and simple way of engaging. There are no simple rules of engagement, so that engagement seems sometimes a bit difficult. And when it doesn't happen or wasn't successful, it was also because there was a perception of conflicts of interest and a bit of an inertia on both sides on how to create that collaboration. But again, and to summarize, when it works, it's fantastic. ERNs are definitely a great achievement of this directive and of the community, and it has a chance to deliver both to healthcare and to research.
Thank you very much, Magda, also for highlighting, this is in a way the first, as you say, the teething period of the first 5 years to try to establish everything. Before we go to the audience, let's take a quick round, because we heard a lot of it. Magda, I think you maybe already covered this, but I'll come back to you anyway. But the really tangible lessons, and Ruben also mentioned it, Birute, also Jan, in the what do we take away? Martin, I will start with you. You had on your final slides the areas of focus for the future, and for me, those are the tangible lessons in a way. But maybe if you would summarize, like, what are we taking with us for the really next steps from the first years of experience, also having heard everyone in the panel, just briefly before we go to our audience. Thank you. Over.
Thank you, Dimi. I mean, very briefly. No, it was very interesting. I mean, to hear the comments, because I think even though they may be phrased a little bit differently, I mean, they match to a large extent the findings of the evaluation, and I think one of the most important areas for further work that was identified is better integration of the ERNs with what is happening at the national, local, and regional level. So we need to avoid, I mean, these ERNs, which are doing an excellent job, at the European level and exchanging the expertise at the European level. We now need to make sure that this is translated and brought to the patients at the local and regional level. And in many member states, this is currently not happening, or happening very, very slowly. With that, I'm confident that this will also improve, for example, the awareness in the rare disease community and among the patients about the possibilities they have, what is the right pathway to reach the expertise that is there. So there were, I would make a distinction between the findings and the comments also made today that are related to the ERNs in the strict sense, and these we will try to certainly to address. there were other, comments bringing up a little bit, wider issues related, for example, to the reimbursement of the cross-border healthcare and the difficulties, in accessing the cross-border healthcare due to the financial constraints. I think this is for a separate. This is a very important issue. I agree, and we need to have that discussion. But I think this would deserve a separate panel or separate discussion, because the issues are very much more complex to be discussed here today. Thank you.
Thank you. And I think, Martin, the experience has been so far, it's exchanging knowledge across borders rather than exchanging patients across borders, at least when it comes to the ERNs. And this is, as you say, a very important discussion to have also on the exchanging patients part, the reimbursement part. We're also thinking about that on digital in general, remote consultations, particularly after the pandemic. So it all fits together, I think, for another series of webinars. We can talk about that. Ruben, I come to you because you mentioned already in your previous intervention this idea of the tangible, let's say, consequences of ERNs for the management perspective of hospitals. And I think, having heard also everyone else, we have a very clear case here also for the integration at national level. But also, I think in previous discussions we've had, it was clear that, for example, those who are involved in part may be doing so in their, like, volunteering their time, basically, because there is no clear financing scheme. So I'm pretty sure from a managerial perspective, this is not a very straightforward thing. So how do you see, like, the tangible lessons from the teething period from the management perspective?
Well, I think, if you think about this, the ERNs are central. Even if you look at the membership is based on hospital participation. There are hospitals that participate in the network, and in fact, all the clinical data that's relevant, at least at some level or another for these patients, resides in the hospital. So we're managing this data, and I think it's imperative that the hospitals have a way to interact with this, with a model, with this platform in a way that's smooth and clear. But then also the physicians, the specialists, the clinical care specialists that work in the ERNs also work within the hospitals. And you also brought up some issues of time concerns, reimbursement concerns. I think that from that observation, I think that we have, I would ask that we focus more on how the hospital manages rare disease care, because that would also impact on how this care is extended to these, integrate this care to the regional or national networks, because there are hospitals that are integrating into the national networks. So I would ask at this stage that we pay attention as to how hospitals can help manage and promote this model, sort of thing, because that would also require for the hospitals to rearrange a little bit the models of care for rare disease, open up to this interaction and collaboration. That's part of the reason, for example, ECHO exists, because we have come to realize that we need to be very collaborative, especially when it comes down to data sharing and model guideline sharing and outcomes sharing, sort of thing. I mean, issues like, and I'll stop here, issues like transition to adult care for patients become relevant, and it's only in the hospital setting that we can resolve these issues and have to share them with the ERN networks.
And Ruben, what would be the best vehicle, you think, to focus on this or to work on this? I'm assuming not only at the national level, but also at the collaborative best practice exchange level, right?
I think, I think the Commission is also entertaining ways to sort of approach, but I think to have hospital participation in some of the decision making, the managerial in the decision making of how to structure these initiatives may not be a bad idea, something for the Commission to certainly consider, to have a more active participation, because, one easy problem that the ERN providers will do is, how many times we have to introduce, information into different platforms. How can we smooth this out? These are simple questions, and we can make a long list about this, but these are the sort of things. I mean, active participation of the hospital management at some level or another, especially those that are very invested in this process, can help smooth out some of these interactions, including the integration of the ERN networks into national networks, because after all, our hospitals are participating in the national networks too. Mm-hmm.
Okay, no, thank you very much. Really important. I wonder, but this is a question for a whole different webinar, how the European health data space fits with all the interoperability questions and information questions. We talk about that maybe at the end if we have time. Magda, I think you were next in the sense that you brought us the potential in your first intervention, perhaps a little bit more tangibly, what are the next step? Public-private partnerships, you said. How do we address some of the issues that you raised in the first intervention?
Okay, so I would like also to come back to the European health data space after that, because I think that's part of the ability to collaborate and data flows and access to data and who can do what. So I would say I'll come back to that in a second. But on the collaboration, I think, as I said, the ERNs are not homogeneous. They are very heterogeneous. They are different in the way they are structured, etc. So I think I'm not suggesting harmonization, because that's a big mantra of some of the European programs, and that's not necessarily the good way of doing. But I think that if we had a positive, constructive framework of engagement between public and private sectors with ERNs, that it's more structured. Not that this collaboration doesn't exist, but couldn't we learn from good practice of where these collaborations really work and establish these as principles for engagement across ERNs, so that this collaboration can be facilitated? Sometimes also companies have suggested that when collaboration has to go with one ERN, that's fine. But when the disease is complex and needs to go across two ERNs, that becomes even more complicated. So a clear rule of engagement and positive, based on what we want to achieve together, based on outcomes that we want to achieve together, would be fantastic to unlock a little bit of those locks and misperceptions. So that's one aspect, and this could be very tangible. It is sitting around the table and agreeing on that and making sure that we all know and communicate it properly. The second is about resources, because what we see is that people do the work on weekends on the top of their day job. And I think that we've said about reimbursement of care to patients, but we also need to resource these ERNs to be able to do that coordination work and this collaboration work. It cannot be a weekend and a hobby horse. It needs to be part of the philosophy. And I know that there is big willingness to do that, but the resources are scarce. So I would like to highlight this part of the resources. And the last point is about European health data space and data standardization. So I think in the Innovative Medicines Initiative, we had one program which is called EDEN, European Distributed Data Network, where resources are put to standardize data at the place where they are in order to enable interoperability. I think that we could reproduce that model across ERNs and to do something similar, because without this standardization, and I think this was also in the chat, in the questions from the audience, without this standardization, we are not going to get there. If these three things are happening, for me, we would have a big leap forward and enable this collaboration on research as well.
Excellent, thank you. I think this also brings us closer to the final round, which we're not arriving at quite yet. Jan, I come to you for a brief reflection, specifically on the ERN's tangible lessons from the patient's perspective.
Yes, from our perspective, really the ERNs are this great instrument of collaboration to improve the quality, to improve the safety, and to reduce inequalities across Europe. But there is several dimensions to it. We're speaking a lot at the moment of the integration international healthcare system, and this is essential because that's the way to go from 1.7 million patients, which are the one covered by the members of ERNs, to the broader 20 million population. So to diffuse more the knowledge and also to generate new knowledge. So that's important, but we should not lose the dimension of the European level, that is also about cross-border care in different ways. First, to enable the patients to go physically to another country. So we insist on that. So there is a link between this aspect of the directive and the ERNs. Particularly, I go back to the binding expert advice here. The second element is the virtual aspect. The virtual aspect should not be limited to CPMS, should not be limited to panel expert advice. It's also about consultation. And for these different services, we need to have a proper costing and a proper reimbursement system in place by the member states, but that is directly linked also not only to member state level, but to provide that actual access to expertise across borders. And that's very much true for the smaller countries, but also for the rarest diseases. Because in practice, for the 400 most frequent diseases, the biggest member states are able more or less to provide quality standard of care, or they will be able progressively over the next 5-10 years based on the current system. But where we have issues is with the smaller population member states, and it is for the 5% population of people with rare diseases who cannot rely on national healthcare system, have automatically to rely on expertise at the European level. So that's really cross-border, and that has to be embedded in the vision of the ERNs at the same time that we're looking at the other aspects of the directive.
Thank you, Jan. Really, really useful. I think also in line with some of the initiatives that the Commission has for the future. Definitely. I think that's also very useful for that. Biruta, we come to you briefly to wrap us up here with the tangible lessons, because then we go to our audience finally.
Yeah, actually, as a chair of a working group on integration, I would like to address a little bit this issue. Of course, as an elephant in the room, it was identified in the Board of Member States already in 2017, and we have established a working group on that. And at first, we had to identify the main areas for intervention, afterwards the objectives and aims in the every area. Also, what was actually very fruitful is to identify best practices in various member states and to share them, because it is a very good way to share the way how to tackle that. But actually, what I would like to stress, why it is not implemented, because we do not know the principles, how to establish care pathways. They are not established as, for example, for chronic non-infectious diseases or other diseases where we have lots of materials for evidence-based policy making. And actually, we do not have such materials in rare disease areas. We do not know the principles. We do not know the principles, how to perform quality assurance, how to perform data management. Therefore, there is a lot to do, and we are now also aiming for joint action in this. And we hope very much that at least some of the work will be done with that joint action by establishing the principles and further sharing of best practices. But indeed, rare diseases is exceptional, and sometimes we do not integrate because we do not know how to do that.
Well, thank you very much. I think that one of the issues, and I'll be very brief, one of the things that ERNs have been doing is also clinical practice guidelines, right? But these are within, I guess, the mostly the inpatient sector, and I think what you're talking about is also a bit broader than that. So yeah, okay, thank you. We go to you, Erica, to give us a little bit of a flavor. I think we're all been keeping an eye a little bit on the chat box at the same time. We have a lot of interesting things. We also got a lot of interesting questions in advance. So up to you to choose one or two that we might merge with our final round of insights, because we're already quite late.
Okay, so obviously a lot of discussion around the barriers to scaling up ERNs and the challenges around that, particularly around the financing of cross-border care and integration into national health systems, and also about ensuring the sustainability of ERNs. So if anybody would like to add anything on that, please do go ahead. But one of the sort of really big questions looking to the future that has come up is how might ERNs develop to support people with rare diseases living outside the EU? Is there scope for some aspects of these ERNs to even go global? So I thought that would be a particularly interesting future-looking thing to finish on. Thank you very much.
Thank you, Erica. This is really an ambitious point. I think even before we have figured out everything for the European Union countries. Okay, I think maybe we think about that for a while. I think for our panelists, we have 5 of you. We have about 5 minutes left. Maybe we go 2 minutes above time, but not much more. So I think there is 2 points. One is the long-term vision, and this is linked to the sustainability issue that Erica mentioned, and probably this issue of not necessarily European countries, patients links with that as well. What I would say is we've heard from all of you the more tangible lessons and barriers from the first years of operation, and they are reflected in the things that Martin talked to us about, the perspectives that are now forward-looking and what the changes have been from the Commission side and what the ongoing projects are in the joint action. So there is quite a lot to be looking forward to and to see how that works. I think it's very important that you all pointed out different things. We come to them in summary at the very end. Now, if we start looking forward to the time from now on, two questions: long-term vision for ERNs. One question: long-term vision for ERNs, and how does that maybe also include patients beyond the borders of the European Union? Maybe, I think, Birute, we ended with you last time. We start with you this time, because you mentioned this issue of inequities when we were starting in the very beginning, right? So when we're thinking about the long-term vision and perhaps also going beyond the member states that we now have represented, how do we tackle this? How do we, at the same time, or maybe one after the other, think about making sure that we reach everyone within the Union, but also go beyond? This is the final statement, by the way. So if you have any core things that you need to mention, now's the time.
Yeah, actually, ERN coordinators, they are, and of course, members and every physician who participate, they are wonderful people. Just because they have chosen rare diseases, it is very difficult area, you know, it demands much more experience and learning and so on. And actually, they are very creative. And for such countries, they already establish forms like supporting members, for example, who are not necessarily designated by authorities. But of course, it is just intermediate way to link the centers to the rare diseases, and authorities have to have that in mind. Inequity, inequity issue. As an additional argument for authorities, I would like to mention that actually poor or not well organized care for rare diseases is actually very much wasteful. And OECD have calculated that wasteful spending in healthcare is about 20%. In rare diseases, it is much more. So for health authorities, it is a message. If we do not organize it properly, you will eventually waste much more.
Thank you. And so I'm assuming this is also linked to the ERNs taking a bit of an active role in this direction as well as part of the future vision. Thank you very much, Jan. We come to you. I think you already gave us a bit of a future vision in your previous statements, but if you think of the big picture and think also of sustainability, but also of perhaps going beyond the EU borders, what are your thoughts?
Right. So the vision for us is very clear. It's all about health outcomes. And it's how we improve the time to diagnose and how to improve the survival and the well-being of the 20 million people affected by rare disease in Europe. And for that, the sustainability issue is key. So that's the funding, but funding is EU funding, surely, as the EU for Health program is doing now. And hopefully that can be sustained and expanded. So to provide the right support to the core functions of the ERNs in terms of coordination, but also to support these heroic clinicians accumulating different functions. But it's also the funding at the national member states, working with the hospital managers to provide the right level of support for these centers of care, for which the doctors need more time with the patients, need more time for the data collection, etc. So there is specific elements here on the sustainability. And the third element of sustainability, which I already mentioned, is that we need to have a right costing of the services for the face-to-face consultation, but even more so for the virtual consultation and for the panel expert advice, so that they can be scaled up. Until this is costed and there is a clear reimbursement mechanism between member states, it cannot be scaled up. The next thing is the European Health Data Space provides, it was well mentioned by Magda and Ruben, provides a huge opportunity to improve all the data operations. So that's really part of our vision for the future. The next is to look at Europe beyond EU. So yes, we could think global network, and as you may know, we're working on that with the WHO and 250 experts in the world. But the first area was the European Union and the member states should look at is how do we work together with the populations in Europe beyond the EU within WHO Europe. So this will be my key elements. And my last one, which is maybe more new, but that we should think much more of, is for the very rare diseases. We do have now some hospitals which have several centers of expertise. They are part of several ERNs. They can be part of 12 to 24 ERNs. Here, we're accumulating a huge expertise. They can be children's hospital or adult hospitals. And these few centers need to become kind of lighthouse, kind of European comprehensive rare disease centers, which integrate all the disciplines and all the expertise for the rarest diseases. And for that, we need to have in place also these systems of reimbursement and access across borders and proper information of citizens of their rights so that they can access to these centers. So it will be a fantastic new step, not only this embryonic healthcare system with ERNs, but also this lighthouse, which will become European provider of care for European citizens.
Thank you very much, and I think it's also quite important to be a bit more disruptive in the way we think forward, even though this is it's a more constructive rather than disruptive intervention. Ruben, we come to you. Long-term vision. You have some experience with patients outside the EU, so perhaps you want to weigh in on that one.
Very quickly, I know that time is constrained. Yes, we are taking steps, to sort of provide a little help with beyond the EU Commission with the ERNs in supporting by providing, for example, with the Ukraine situation here, how to provide support in that setting. I pick up on where Jan picked up. I think the issue here is health outcomes at the end of the day. I fully agree with that, and I think. Just to make it sure, I think data standardization, data sharing is a major issue here for rare diseases in particular, because they're rare. And I think that's when you can also say that you can go beyond the EU when you need to, because that's the nature of this entity here that we're dealing with. I think increased access, which is part of the mandate that the European Community, it has to be, revisited as I think the Commission is already doing, thinking of remuneration models for specialists and hospitals involved in that has to be on the forefront for both member states and the Commission. I think the models of care, hospitals have a responsibility to restructure the model of care so that it provides real answers for these patients. And let's not forget about cross-border care, because if those lighthouses that Jan was mentioning do occur, some patients have to be able to get there, and get their assistance and be attended. And I think that this all will lead to better research where we can really have multinational trials for these diseases, which is much needed because of the volume of patients needed. So I think if I can summarize this would be my point.
Perfect. Thank you very much, Ruben. It was really very clear and to the point. Magda, we come to you for a very brief reflection before going to Martin to close us. Over to you, Magda.
Thank you. So what could I say that hasn't been already said? So let me just highlight three things. The first one is the ERNs have already a very ambitious vision, and I agree with the vision led down by Jan just right now to scale it up. But I think that first of all, the vision is already ambitious, and we need to scale up and upgrade and give resources to achieve that vision as a step one. Second is, I hope for a future where ERNs are at the heart of public-private collaborations and facilitate a structured engagement, and this integration happens. I think this is necessary. We know that today collaboration is not a choice, but a must. And I think we should take the best out of public and private sectors, get them together and help patients and help outcomes in the end. The third, I cannot highlight more the EHDS, European Health Data Space, data standardization, and working on that together. They are good examples. We can scale up using models and resources from different sources in Europe. So yeah, I think that's all I would like to say, but I subscribe to everything else that's been said before.
Thank you very much, Magda. Also very to the point. Martin, you have a very long list here of tangible considerations, but also high-level aspirations. I think a lot of that from the very pragmatic of finding the remuneration models and the financing models that will work to the expansion and optimization, let's say, of structures are things that the Commission has thought about based on the slides, with perhaps some additional ideas, links to European Health Data Space. A final word from you to close, as we're already over time, about how you see the long-term vision and the next steps moving forward beyond the very, very tangible ones. Over to you.
Yeah, thank you very much, Jimmy. I think, and it was really fascinating and interesting. I mean, to hearing all these proposals and ideas, and I think they very much go to a large extent in the same direction. I think it is very important to have an ambitious long-term vision and a goal. At the same time, it is, in my view, important to go, step by step in a gradual way, and start from things that we can improve in the short term, and hopefully, in the long term, we will reach that ambitious goal. The ERNs, I mean, we have the best experts in the field that are working together, and I think what we need to do just now, I mean, give them all they need so that they can do what they do best: treat patients, diagnose patients, and do research in this area. And I think it is important, I mean, to address especially three things. So one was mentioned already, and clearly it's a funding. It's ensure the sustainability of the system. To have a clear and transparent funding easily manageable funding at the European level. But at the same time, it's just the tip of the iceberg. I mean, there needs to be additional support coming from the member states. The second element I would mention, we need to equip them with the tools that they need so that they can do what they know best. And by the tools, I mean the IT infrastructure, but also, for example, the data in the format that they can use, being interoperable. And also, we need to give them time. I mean, the resources. So this is the point mentioned with regard to the support that is being provided by healthcare providers to the networks, that they really, I mean, have the resources they need to help the patient. And the last thing, I mean, we need to improve the access to the expertise that we have. And that needs to be done on several fronts, starting with the awareness raising and dissemination of information, clearly defining, I mean, the ways how to reach to that expertise, and also making sure that their expertise, once available, is also affordable. So touching upon the issues related to the reimbursement. Thank you.
Very much, Martin. That was also a great summary, I think, of the things that we have heard. I think I will end with a quote from the evaluation that Jan already mentioned in the very beginning. It says the ERNs are a diamond, and it needs to be further polished before it can truly shine. And I think taking the lessons from today, the way to polish perhaps is really the stakeholder involvement, as you're already doing, perhaps even ramping up in different ways, be it the patients. Jan told us about it in the chat box. We heard about being the hospital managers, the coordinators, but also the industry and the private public collaboration. A long road ahead, I think, but a very interesting and very valuable road. And I think we will meet again in future to see how far we are with polishing the diamond in due course. We thank you all very, very much for being here with us today. We're very grateful for all the insights, and we hope to see you again very soon. This is the last installment of this series, but we will definitely have more series coming up. So thank you again. Enjoy the rest of the day, and see you all soon. Bye-bye.